You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, let's get going.
Hi, I'm Ivan Zach, and we are interviewing today Dr. Katie Lyttle. We're going to talk about the genotyping in dogs. Katie is the veterinary channel manager with Wisdom Health. Previously, she was a lead doctor at Benfield Pet Hospital. And she has Masters of Science in Veterinary Medicine from University of Florida, Masters of Public Health from University of Florida, and DVM from University of Florida. On a personal side of things, she knew she wanted to be a vet at the age of 6, despite being horribly allergic to everything feather or fur, thanks to immunotherapy that ended up not being a hurdle. She was born and raised abroad, born in Puerto Rico and raised in Brazil and Chile. Her father is from Cuba and came to the USA as an asylum seeker. Loves to travel, hike, ride horses, and fly fish, but is perfectly happy at home crafting too. Volunteers as a Spanish interpreter at a Washington-based human medical clinic. Katie, welcome to the show. Thank you for finding the time.
Thank you for having me.
Another fisher person, Ivan. This is great.
I know, finally.
And a fly fisher woman to boot. So I'm excited that other folks say they fish, but fly fishing is always an exciting one.
You have to come to New Brunswick.
Yeah, it's super hard. I actually took a couple of classes with my wife, and I have this lucky combination in my family. Me and my wife were both like fishing, so we took the classes together. She wasn't that great at it. Of course, I was better, but that I can only say that because she never listens to this show, so that's fine. But it is hard.
I'll tell her, Ivan. Don't worry.
I'm sure. With friends like you, I don't need enemies. I know that. So where do you fly fish, and do you get to do that often?
So I probably don't get to do it as often as I would like, I would say nowadays. But I actually, because I grew up in Chile, we learned to fly fish in northern Patagonia. And when I tell some folks that here, they're always like, oh my gosh. Well, that was like the only fly fishing experience that I had for the majority of my life. Now I live in the Pacific Northwest, and we have a lot of rivers, beautiful rivers out here. There's a little bit of lake fishing and such too, but I did mostly lake fishing in southern Chile, and then out this way, it's wading and bankside fishing in the rivers of the Pacific Northwest.
That's awesome. And how old were you when you moved to the USA?
16.
16. There's not even a slight accent. And that's probably because I have more accent than anybody else. And that's why I don't hear it.
My mom is American, and I went to the international school. So like my curriculum was always in English.
Awesome.
And we did travel back to the States every year to visit family. But I have a very flat accent in English as well. I don't have a specific regional one, though when I travel, I pick up the local tones.
Oh, that's interesting. When I go to the US, that's usually when people say, are you from French Canadian side? Because they hear an accent and I say I'm from Canada. Some people can pick up that it's not French Canadian, but those are accents. So with a long academic career like you went through, I mean, there's 2 masters, there's DVM, and then transition into this area. How was that transition? How did you end up working on genotyping dogs, and how your education and career path led to it?
It was really a happy accident, and I'm super fortunate that turned out that way. But I graduated vet school with an intent to go into large animal medicine, for starters. And I really wanted to do international development work, leveraging that skill set in that capacity. And I went to mixed animal practice first with the intent of coming back to a master's in public health. And I did that a little sooner than I anticipated. And while I was in school as a graduate student, decided that I needed to also bring in some money. And so I started working in small animal practice through Banfield, and found that I actually enjoyed that work quite a bit. And once I finished my Master's of Public Health, which had also acquired a sister program in a Master's of Science, I finished those and went straight into full-time clinical practice. Did that for a couple of years, and then to really cement that clinical education that I'd spent such a long time gaining, but with an eye towards the next thing. And I happened to have lunch with my mentor, who was at the time headed up the research team at Banfield. And Dr. Elizabeth Lund happened to mention that the group over at Wisdom Health, at the time we were Mars Veterinary, was hiring. And I had dinner with them that night and that's sort of how that came to be. I did have some genetics as part of my Master's of Science. That was specifically around bacterial science. I looked at MRSA and companion animals. And so that was a useful starting off point for the genotyping career and the genetics career that I've spent the last 8 years in. But I've certainly done a lot of learning on the job in this role.
Wow. So that kind of brings me to sort of two topics joined into one. One is that not everybody who goes to vet school ends up working specifically in the veterinary hospital. Neither some of us are inspired to do so. I spent 12 years in clinical practice, and then, when I transitioned to software in the veterinary domain, that became a huge interest of mine, and which I'm still pursuing. But also, I see a lot of folks that go to vet school, and they're very disappointed when they experience it through the vet school, they understand that's not for them. Mm-hmm. And there's tons of opportunities out there. And you found one. And then the second piece that I want to weave into it is that there's a lot of sort of stigma around the consolidation and the corporate and stuff like that. And then Mars being, the biggest, the oldest is probably the best. They surely represented in your case the fact that as a veterinarian, you can progress not only linear in the hospital and be, grow in that, but also go sort of in the other areas of veterinary medicine. So what do you think about that? And are the corporates good for the industry or bad?
I think that that's a good point and a good question, Ivan. So with regards to the situation that I was in, I was able to go to school full-time and work full-time because of the benefit that Banfield saw patients 7 days a week. And I was able to supplement my graduate school career because I was able to bring in income. And I appreciated the clinical knowledge that I gained in school. I appreciated being able to apply it, and I really enjoyed being a clinician. I still actually do relief work to keep my skills up to date and keep up on what's happening in the clinics. I've done a few shifts during the times of COVID, and hats off to our colleagues because their life is so much harder right now than it has been. And clinical life is not easy. It's not a walk in the park every day, as we well know. But the benefit of the corporate lifestyle for me, I've benefited hugely. I was able to work while in school. I was able to do a lateral transfer of the system. So we have the unique ability of having access to the genetic data from pets that are tested that also might be patients at all of these Banfield hospitals. And also hopefully in future VCA hospitals and the like. At the very end of 2018, in December of 2018, we actually did an integration with Banfield's Optimum Wellness puppy plans. So all puppy plan pets, dogs, I should say, puppies, and not kittens, have access to a wisdom panel test as part of their plan. So you have around 250,000 pups coming into the system every year that are going to have wisdom panel tests. Obviously, some subset of those pups are going to stop seeking care after their puppyhood because people have that perception that they get their puppy shots and then they move on. Some will seek care elsewhere, but a good subset of them are going to continue to be patients of the hospital system. And so we're going to have medical records on these patients for years, and we're going to be able to drive discovery, and that will fuel innovation into our pipeline and really help push the profession. So we right now are looking at over 400,000 dogs that we have genotype data and medical record data of some length of time. So obviously with the launch in late 2018, those are still young dogs, but Banfield has had genetic testing available through Wisdom Panel since 2007. So we've actually got a fair number of dogs that were tested prior to that. So it's a pretty exciting opportunity, and it's only one that can be done through a group such as the Mars ecosystem is building.
Katie, it's so interesting. And I remember, I think it was about 6 months ago that you and me had our first conversation about the interesting work that you all are doing at Wisdom Health. And I can't believe that 6 months has gone by. Wow, where did the time go? One of the things that I was really interested in when first learning about the work that you all do was the fact that it's accessible to anybody. So, any veterinarian, whether they're in the Mars ecosystem or not, can benefit from the work that all you have done. And I think, to take a step back, it would be really interesting for you to just kind of give us a quick overview of Wisdom Health, the work that you're doing, and maybe some of the interesting things that you've seen emerge as you've gone on this journey.
Absolutely. And so, realistically, Wisdom Health exists because people had a vision long before we actually knew what we were going to get out of it. So the Canine Genome Project didn't even get completed until 2005, but Mars hired its first geneticist in 1999. Let's figure out what's going to be coming out of this space and do something with it. And the unit started forming around that core group of individuals that came in and started taking that very initial data that was coming out of the efforts of the scientists involved in the Canine Genome Project. And Dr. Elaine Ostrander and her laboratory, at the time they were at Fred Hutch, they're now at the NIH, developed a process for helping to identify dogs of certain ancestry. So they used a set of markers and were able to bin, if you will, dogs, say these are the Arctic breed dogs, these are the herding breed dogs, and be able to define them into their subset of breeds. And then they later patented that. And that patent was then exclusively licensed to Wisdom Health. And we were able to leverage that into the product, the very first product back in 2007. It was a rudimentary product at its initiation. So as with many things in technology space and in science, we iterate and we learn and we improve and we build upon. And so what initially was a product that would tell a pet parent or the veterinarian that there was primary or minor matches to these breeds has become a product that can tell the veterinarian that there's specific percentages of a breed present, that account for, say, a grandparent German Shepherd or a great-grandparent Labrador Retriever. And we now have the addition of being able to layer on health information because the science has also identified a lot of specific genetic mutations. So now we have the benefit of breed information, and we're now able to layer on disease information. And today we have over 200 diseases available in the Wisdom Panel premium product. Those things together really become key and important elements for veterinarians trying to make decisions for our patients. Knowing the specific status around those key mutations, MDR1, for example, the multi-drug resistance gene, which was identified by Dr. Katrina Mealy at Washington State, and Wisdom Health has the exclusive license in the US to offer. So that mutation will help us protect patients that are undergoing anesthetic procedures, because a couple of the medications that we use as pre-meds for anesthesia, promazine and butorphanol, use the pump that is rendered ineffective with a dog that has an MDR1 mutation. So we can, knowing that, prevent bad outcomes. We know that we can't give them ivermectin if they happen to be a diabetic case, because that patient will go on to suffer adverse consequences. And no veterinarian wants to be the one causing issues in a dog that previously appeared healthy. The flip of that is dogs that have a genetic condition for which we don't have a treatment. So, for example, primary lens luxation. Over time, the lens loosens and eventually falls. It can fall forward, it can fall backward. I actually had a dog that had this, and in her case, both fell forward, which is unfortunately an emergency in both cases. But those patients today, we don't have a solution for, but we can help counsel the owners as to what to expect and what to look for. And we can also create a really specific treatment plan for them and have them come in with more frequency, perhaps, and say, instead of every 6 months, we really need to have you come in every quarter so that we can have a good look at your dog's lens and make sure that it's not detaching faster than we expect. Or at home, if you see that the dog is winking really hard and the eye is bulging or pawing at its face, these are things that are an emergency and you need to bring that dog in immediately, right? So we can really have a conversation with the pet parent and produce a care plan for that pet that is going to help them have a healthier quality of life long term. And as then we have all this data coming through from all these patients that we're testing, we're going to, over time, be able to drive additional innovation. And that then is going to have an impact well beyond the Mars ecosystem. So the veterinarians that today are not part of the Mars ecosystem, and I do think that there will always be independence, and I hope that we continue to have that strong presence because it's a wonderful community that we have in our veterinary space. They can absolutely benefit from the findings of this type of integrated ecosystem like Mars is leveraging, because that information is made public. We don't want to hold it and make it available exclusively within our hospital's walls, because that's not what we're about. We're about really doing the best that we can for our patient population, and those within as well as outside of the Mars ecosystem will benefit from that.
So I did a big study right now on the veterinarians and the burnout degree, and I was trying to associate relationship with the corporate, non-corporate, but we had a couple other discoveries throughout this study, and the big part of the work that I've done, I've reviewed the consolidation from the angle why people do it and why is it useful to the industry, and you know, aside from the return on investment for the consolidators through acquiring hospitals, selling hospitals, the big benefit is creating projects like that when the consolidation comes to the point where they don't want just to earn more money, but they're trying to do something innovative because they have a slice of data of that size. They can start
Absolutely.
large initiatives with a long strategic horizon, like the genetic testing that will bear fruit in 15, 20 years.
Right.
And what you just described is what, I listened to, I think it was an MIT professor, and he was talking about the difference between innovation and invention.
Mm-hmm.
Invention is, inventing how to test this breed and how do you determine them through genetics. But the innovation is to bring it to market and actually make it work and make conclusions on a regular basis, and then everybody can use it. And I think that that's what you just described. Mars is actually doing that. It's not just coming up with the cool stuff, but it's actually bringing it and how it can affect long-term the pet parenting, the quality of life, the prevention. And with that, of course, it's weaved into a business. So I can see how now insurances can leverage, and the veterinarians can propose insurance, which also will help the industry. We're only 2% compared to Europe insured. And then if I know that the lens luxation is something that my dog is predisposed, I would like to be insured. So this is amazing what you're describing. And I think that this is just a great example where consolidation is helpful. And where do you think this product on its journey to get there? I know that you mentioned that it is available, but is it something that everybody will start using soon? Is it something that Mars promotes as the testing internally? And then there's a publication or there's books that you can actually have like a reference, or with the testing, okay, here's the potential ancestry in these types of breeds. Watch out for these things, therefore tell the owner. Is it getting to the level of just magazines right now, or is it getting to the level of textbooks, or is it getting to the level where it's already taught in vet school? Where are we at?
So it depends is the answer to that, right? It depends on where you are and where you get your information and who you are as well. So it's probably not a surprise to the two of you, but in general, as a very broad brushstroke and a stereotype, the veterinarian is a bit of a technology laggard. We're skeptical by design. We want to have proof before we hop on board. And typically that means that we're not early adopters. Now, there's always a subset of people that can see the immediate benefit or are excited and will give it a try. They're going to try it on their own pet first and get their own experience to influence and inform their decisions for their patient care. But this product is not new, and this technology is not new, and this concept's not new, and it's been around for over a decade, and we've tested over 2 million dogs in that time frame. And we know that there is demand, and certainly the fact that there's a lot of interest on the human side for their own personal interest, right, around their own ancestry and their own health predispositions. There's that carryover effect and halo effect on our pets, because you go to the dog park and people are like, what's your pet? And I'm like, I don't know. I have no idea what this dog is. And everyone's got a different opinion. Let's just figure it out. Let's just test, right? So it has been principally driven in the past 10 years through consumer demand. But we do think that the veterinary channel and the drive within the veterinary channel will continue, it will progress, and it will speed up. And the reason for that is that we're moving the paradigm of care. So if you think around our historical standpoint on what constituted preventive care was vaccines, it was deworming. Then add in heartworm prevention and flea control. We've expanded that to include dental prophylaxis and dental cleanings and nutrition. This is another layer on our preventive care. If we really know what that pet is predisposed to, if we can counsel pet parents around expectations, give them tips and tools, and really prepare them, how much more individualized and personalized in care can we get than really understanding a dog at its core, at its basic DNA? And the DNA doesn't tell us everything that's going to happen. We don't know all the answers. I mean, there's so many things about this that we have yet to figure out. And one of the great things, going back to what we were talking about earlier, in this activity that we're able to do in our large ecosystem, we do have the ability to look at novel candidates and help identify new things that then expand our knowledge as a profession and we're able to address. But until we have those, there's also just associations. And in that instance, we're able to say, okay, well, knowing what we do about, for example, epilepsy tends to show up in Cocker Spaniels. We don't have a gene for it, but there's a breed association there. We can counsel clients that have Cocker mixes around what to look for in those cases, and then learn and hopefully get to the point where we can actually have a mutation that we can test for, and then say, this Cocker Spaniel mix has it, and this Cocker Spaniel mix doesn't have it, right? That's what we want to get to, and be able to really help these patients and pet parents as they go through and enjoy their pets the most amount of time possible.
Katie, it's been a fascinating conversation, and I applaud you and the whole Wisdom Health team for driving the veterinary profession forward and also making the work that you're doing available for everybody. I think it's absolutely incredible. With that, we're out of time, and we've always liked to kind of end the same way. So I've got a question for you, and then I'll ship it over to Ivan for a wrap-up question, and then that'll be it. So what's a book, a TED Talk, something that you've seen or ingested that you'd like to share with our audience?
So this book is actually one that I read over 20 years ago. And it is not specific to any piece of this profession. And it was just an insightful book that I found impactful at the time that I read it. And it still resonates with me today. And it's the book is called Tuesdays with Morrie. It's by Mitch Alborn. And it's just a beautiful book and a beautiful story around a relationship and learning around the important things around life.
I really appreciate when people share something completely out of not the industry. And so the second question that we have is that, do you know any other innovators in the industry that this podcast would benefit from as a guest?
I can think of several. So I definitely think that our friends over the Pet Insights team, which is part of the Mars umbrella and associated with Whistle, are folks that would be of vast interest for you to speak to. So Scott Lyle and Dr. Letha Carson would be just very interesting individuals to spend some time with. And I always just love hearing about what they're doing. It's not dissimilar to what we're doing, but it's got the different twist because, of course, it's based on activity monitor tracking. And I would also, I think that we have some friends over in the world over at Merck that are looking at some interesting things. And Kim Hutchinson is just a great contact over there. And he's just got a lot of irons in the fire and is looking at a bunch of different opportunities. And so he might be somebody that you would enjoy spending some time with and speaking to.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryinnovationpodcast.com. See you next week.